All right. Hi, Jason. So nice to see you. We're with iNAP. I'm Lori Schulman, and we have Olivia Lozrell, our general manager, here today. We're really excited to have Jason Sazama with us to talk about his experiences using iNAP. Jason, why don't you go ahead and introduce yourself?
Yeah, I'm Jason. So if this is posted, I mean, you guys can certainly post it to whatever you guys have if you want. But yeah, the LankyLefty27 is a YouTube channel. And you guys were kind enough to send me an iNAP to try out after I hounded you to let me have one. So
not for too long, not for too long.
So I'm always looking, I think I told you guys this on the first meeting, I'm always looking for something that's different. It's not CPAP, but is also going to be a viable option for people that's also non-surgical, no implants. And so when I had someone tell me about the iNAP, a physician, I thought it looked like a great alternative. And so I wanted to try it out. Reading the literature, it looked like it was right up my alley. So I should be one of the people that has success with it based on the look like the studies you guys had run. And so this is, I mean, technically this is kind of like an onboarding. Like if I were a user, I think you guys tell me if I'm wrong, but yeah, you guys can hopefully answer some of my questions as I think like a typical consumer would probably have.
Sure.
Okay, so let's ask you, Jason, how, since you've had the iNAP, tell us about your experience. What was it like when you opened it up? Did you feel like you had enough information to use it successfully?
Yeah, so I had plenty of information. You should definitely read through the packets because there's a lot of information there. And because so I deal with this a lot with people, and it's like mouth leaking is a huge issue for people with CPAP. I think mouth leaking is also going to be an issue with the iNAP as well. So one of the things I experienced, like first night was a complete success. I slept 7 hours. It was great. I just woke up a couple times and had like a lot of saliva, like you said, I would probably experience. And actually even the literature says if you are someone that uses Invisalign, which I happen to use, you might be used to it or understand that happens. And it definitely happened with me. So that wasn't a huge deal though, but there were a couple times I remember waking up and it was because my jaw had fallen back. And so I had a little gap, the machine kicked on, but it had broken the seal and I kind of did one of those. But I noticed when I initially put it on and I finally figured out how to kind of get the suction to work and get it to seal and like kind of like vacuum seal my oral cavity, I could really feel it pull my tongue up and forward. And I could also feel like my uvula kind of pull up and forward. And I was like, wow, I can really breathe easily with this. So that was my initial experience. And then I said, you know what a great idea would be is if I had a chin strap or some tape to keep my mouth shut. And that's when I looked in the literature and I saw you should use a V-shaped strip right here to whatever. So I did that last night. And what I had last night is I don't know why, but I had much more saliva than I did the first night. And then it felt like the negative pressure of it kind of sealing my mouth closed and pulling it forward. It felt much stronger last night. And I think, Lori, I mentioned I wanted to ask you about the pressure and if you could adjust the negative pressure. It was weird because the first night I felt like I slightly didn't have enough. But last night it was almost like, wow, this is almost too much. So I didn't like why that would occur.
Well, I don't think there is no change to the pressure. So the device is set, it's a fixed pressure. What you experience can vary from night to night. So the device is set at minus 54 cmH2O. That's a minus, it's a negative pressure. And that's considered very mild pressure when you compare that to, let's say, sucking from a straw. So if you were drinking like a smoothie, for example, that would be like a minus 200. So okay. Compared to that, this is a really mild pressure. The differences from night to night, this is very typical. I mean, we see a lot of people who have night to night variability with the iNAP. And so overcoming the first few days is what we see as being a challenge for some people in that they have excessive salivation, which is that's a very common issue that we see. And being able to keep the mouth closed is the other thing. So the suggestions that you saw or you read about are part of what is our troubleshooting process so that you can actually get over it.
I think we can add to that, Lori, that the excessive salivation will just disappear after 2 or 3 days. It's just, your brain try to figure out what is that thing that you have in your mouth you're trying to keep overnight. and this first reaction is like excessive salivation that you've experienced with your Invisalign. And for all of our patients, 2-3 days into it, that's it, it's gone. So the brain said, oh, okay, now I understand, I have to keep it. Even the opening of the mouth, it's normal that it happens. It's normal that you're not like super successful at the beginning. We suggest our patient to actually use it while they are watching TV during the day. So while they're aware of what's going on, they're aware of the positioning of the tongue. It teaches the brain what it needs to do with that thing. Now, when you're unconscious and sleeping, eventually after a few nights or even a couple of weeks, whenever you open your mouth, you will unconsciously recreate the seal and close it again. It's almost like a learning. Your body, your brain has to learn to use something that they need to monitor while you're unconscious. That's kind of the trick. Mm-hmm. But I found for myself, for instance, that it came fairly quickly.
Yeah, it's a very intuitive device. I feel like you said, there's one button.
Yeah,
you just clean it when you get it. Like all the instructions were I was actually impressed. It was very well laid out. So I was like, I was always trying to look at stuff as a consumer, and I'm like, this is very easy. The initial washing, like sometimes you follow the directions and it's not like it says it's going to be. But when I was using this, it was very much as advertised in the literature. Like, do this, do that. You'll see this flashing light. Lay it on its side and whatever. So everything was easy. Even like what do you call it? The dry
pad.
Dry pad. That thing. By the way, that was extremely heavy after the first night.
Yes,
that's normal.
But imagine having to clean your saliva container without the dry pads, like full of saliva. That's kind of not the best experience, especially when you wake up in the morning.
Sure.
Whereas with a dry pad, you just like toss it, and the rest is like dry and clean.
Yeah. But my experience was great. Though I think my only thing was a fear that the tubing coming to me was not long enough. It was never an issue, so I just actually put it next to me on the bed.
Mm-hmm.
But like I just kept thinking about like, if I roll over, it's gonna pull it off and yank it out of my mouth or whatever, and it never did. But it was just like that, psychological barrier I had to get through. And I said, forget it. I'm just gonna have it like laid next to me. It's so small, so it doesn't even matter. But
right.
Now, Jason, were you able also to use the app? Were you able to pair the device with the app and look at your results in the morning?
Yeah. So I was going to ask you about that. So one of the things like I do, like when I'm looking at CPAP data with patients, is there's like an overall leak value that it gives you, which to me, I just don't find helpful at all. Is there a way in the app to do like a trend window where it can show you like the seal was broken here at this timestamp and the seal was broken here at this timestamp?
Well, the app shows you the hour by hour. So it's not like by minute or by second, it's by hour. And those like vertical bar, you have a usage, like let's say usually it's a full bar because it's 60 minutes per hour. And next to it, you have a seal time. And let's say if your bar is a little bit smaller, like let's say 50 minutes, that means during 10 minutes during that particular hour, let's say between 2 and 3 a.m., well, you didn't have perfect seal, and then the pump kicked in and trying to re-establish the seal. So that's a way to tell you hour by hour what happened. And then you have the overall result said, okay, you slept 7.2 hours and you had a 85% seal time overall. So you got the overall score for the night, I would say. It's not the score, but the data for the night, but also you have it hour by hour on the app.
Gotcha. I was looking for something more like a ton of like data points, which I don't know if that's even possible.
So those are collected, and we have a cloud platform that's visible for the doctor, not for the patient. So the doctor will have that granularity that you're talking about.
Oh, okay.
And by the way, we also work with a different type of oximeter, whether it's it's a finger oximeter or if it's a ring, or even a Fitbit. So you can you can actually synchronize those devices, those sensors in the morning on the same app. And then the report will tell you what I just mentioned to you. So the seal time hour by hour, but then in parallel, you can overlay your oxygen desaturation and say, oh, that hour, I didn't have a good seal. And this is when my ODI started to go up. I had several events. Well, we understand why, because of the problem of the seal. And they give you some sleep staging information as well. So for people who love data, I'm one of them, it gives you some good information. And by the way, all those data are also automatically pushed to the cloud for the physician to see. So the physician will see everything that I mentioned before with that granularity almost by the second.
Gotcha. Okay. So I have a question since you brought up the doctor. So as far as if someone needs negative pressure, or needs an increase in the negative pressure, by the way, I don't think I do because my wife was perfectly happy I wasn't snoring. She said, I was like, how do you like the device? Did I snore at all? She's like, no, you're on your back all night and you're quiet, so I don't really care. As long as you're quiet, I'm good.
Success.
But I was just, because of the seemingly difference between night 1 and night 2, it got me thinking, okay, what's the process? And I think I asked you this before. How do you know that you need to have a pressure change to increase it or to decrease it? And who does that? And how does that work?
Yeah, it's a very good question. So snoring, or if you still have some level of snoring, it's not a sign that the treatment doesn't work. It's a sign that there might be some adjustment needed. Like snoring can be a telltale, or residual snoring can be a telltale. If the seal is not perfect, like you're losing the seal, that also telltales that, again, it's not that it's not working, that it needs some adjustment. Adjustment can come in different forms. It can be adding, a tape. It can be adding a chin strap. It can be changing the intensity. The intensity is how fast does the pump reaches that set pressure. Or it can be pressure adjustment. But right now, only doctors who are willing to do that could do that. It's not FDA approved yet, the pressure change, because the device has that the ability to do it, and the doctor can do it remotely, but it's off-label. Mm-hmm. But it's a conversation between the patient and the physician. And in other countries where we sell the iNAP, it's approved, and we filed actually late last year an extension of our FDA in order to make it kind of like a normal procedure. So right now it's off-label, but doctor who think that it can help the patient can do it on their own judgment.
Sure. So okay, on that note, like with CPAP, I mean, most people know if you increase the pressure too much, you're going to start to induce central apneas. So is there a negative or a harm to having too much negative pressure?
Frankly, I don't think at all, because, most of the time the device is idle. So the higher pressure will help people maybe with a higher BMI, with a heavier tongue, for instance, or heavier soft tissue to pull them forward and stabilize them. Once it's stabilized, once the sensor reaches a set goal pressure, it stops. The pump stops. It just holds everything in place. So nothing will happen beyond maybe some kind of sore in the palate or on the tongue at the end of the tube when the negative pressure applies. And that, again, might disappear after a few nights. But there's nothing serious because, again, we're not pushing anything into the people's respiratory system. There's no such thing as, like dry mouth or bloating or other stuff like that. It's really local in your mouth with your soft tissues and tongue.
Yeah. No, that makes sense. I was thinking about it last night. I'm like, well, what would the negative be? Because it's gonna pull out. It just pulls out all the air, and once the
Yeah,
air is out, like making it more
that's it.
negative, is it gonna do anything? Because it's already off anyway.
No, no. Once there's
Yeah.
no air left, that's it. Nothing is happening.
Yeah. Yeah. I was gonna add one more thing. Oh, because you mentioned like the I don't know what to call it, but the probe that kind of sticks into your mouth.
Stem. We call it a stem.
The stem. Okay. So the stem at one point, like, and that may have been it. You just said if that happens to poke the end or whatever. That actually poked into the roof of my mouth last night, and
Okay.
that may have been why I felt like it was stronger than normal. So I just readjusted it. But I was wondering if there's like a tip or a trick that you have if that needs to be slightly lower.
We do have a different geometry and different size. So this is a longer size. For instance, we have 3 different sizes of that. So everybody has a different geometry of mouse. So it's really hard to do one size fits all. Usually it never does it. But yes, so we have different geometries, and there's mostly this stem, that part that's a little bit shorter. Some people even like take a piece of like a pair of scissors and cut them.
Okay, I was going to ask if I could do that. I noticed mine is a medium, but it felt like maybe a quarter of an inch too long or something. So
you can still, I mean, try. That's not part of normal procedure, of course, but we know that some people are trying to adjust them, and even the that kind of the flange here, the outer part.
You can trim that.
Sometimes, they feel some irritation, even though it's a super soft material and super comfortable. They might find some irritation because it's a bit too wide. The same thing, you just like.
Will you send me a small if I screw it up?
Yes.
I'm teasing. I did. So to that point, that material, I was almost expecting it to be. Well, I didn't know what to expect, but to me, I was like, this is not going to be like a soft material. It's going to be hard, which doesn't bother me because like if you play sports and have a mouth guard, you're just kind of used to that feeling. But it was really soft, and it felt like it was just. Sounds weird. Felt like it was part of me.
That's a very, very good remark. I like it. I might steal it. The main reason why, think about a vacuum wrap.
Yeah.
So if you really want a good seal, you want the material to really conform perfectly with the geometry of your teeth and gum. And that will create a good seal. If the material is too stiff, there will be gaps, and there will be leakage to those gaps.
Mm-hmm.
Yeah, for sure.
Why,
I liked it. So, okay, those are good tips, and I can actually, I will make use of some of those. I was almost wondering last night if the excessive salivation was because I taped my mouth, and maybe it was coming open, and some of that saliva was able to vent a little bit. Who knows? But I'm going to keep plugging away until the salivation goes away. And then I was talking to Lori about wanting to try it with my home sleep diagnostic testing equipment. Just try it myself without it, and try it with it, and just see. Because I mean, just my own impressions is that it's definitely helping. Because if I don't wear CPAP, I cannot sleep on my back. Like it doesn't happen. But I made a conscious effort to stay on my back with it. In the first night, like I slept like a champ and had like one of those long dreams that are like a relaxing dream, not like someone's chasing you trying to kill you, where it was like super relaxing.
Well, you were in REM sleep, so that means you were in restorative sleep, so that's good.
Yeah. So I was like, this thing's working for sure. Like, it was a good first night. I just needed one of those little dental tools that like sucks out the spit as I'm sleeping. But okay, if I'm looking at like a day or two more, I'm powering through.
And also some people take just a little longer to get over the salivation, so it could take a week or so, but just know that is part of the experience that most people feel.
Yeah, you warned me of it, so I was fairly warned. It even has it in all the pamphlets.
Good.
Well, great. That's all the questions I have. Is there anything else I should know?
We are always trying to bring more tools to help our patients. So you've seen the iNAP, and some patients who have more difficulty than you have, we want to come with some new help to have them become more compliant and successful. So stay tuned. I cannot mention more right now. The thing I did mention to you are all our oximeters. You know, like we're working with rings like that. So this is a circle ring. We also can use these guys. That's a Welu ring. Those are like, I like those rings because they're more comfortable than your clip on the finger that kind of painful after a while.
Yeah.
And that's to have a richer communication with your physician. And we feel that as a chronic condition, you will evolve, your condition will evolve as you do a better job with a treatment, for instance. And then constantly we'll need some, fine tuning here and there and modification and stuff like that. So, you're there for the long run. I mean, our patients are there for the long run, and hopefully the iNAP will help them. But as we learn, as we get feedback from the market, because we've been in commercial phase for about a year here in the US, like kind of on a smaller scale, just to learn, we're going to be bringing this year more stuff to coach to help the patient be more successful with that. So in the form of devices or in the form of technique to better use the device.
Yeah.
Not other mouthpiece as well, other mouthpiece geometry for some people who are struggling with the one that we have right now. I mean, there's again, we want to help them be successful with the treatment.
Yeah, for sure. That's the goal for everyone, right?
Right.
Yeah,
Sure.
yes, definitely. Yeah.
Right.
It's nice though that there's no headgear involved. One of the things I was actually thinking of is maybe you've already thought of it, like for pediatrics, if they have to be put on CPAP, then you start dealing with the growth plates of the face being kind of deformed as they're growing with a mask stuck to their face. Mm-hmm. So I was thinking the iNAP would be a really good option for those, like for peds who are still growing and you don't really want a mask stuck to their face during those.
Right. You bring up a good point. I mean, I know that there'd be a lot of pediatric patients who could benefit. Right now, FDA clearance is only for adults because all of our clinical studies were done only in adults. But, we'll see where the future takes us because I know that this could be helpful for pediatrics.
Mm-hmm. Absolutely. Yeah, I know you have to go one at a time.
Think about the kids who were on pacifier and how the soothing effect of a pacifier, you can see that we can get an oral appliance that is the size of a pacifier. And so they will be, by definition, from the get-go, they will be used to it.
Mm-hmm.
Yeah.
Yeah. Oh, one other thing I was going to ask about, because I felt like last night, my teeth, there was a slight pressure on my teeth pulling inward, which I wasn't worried about because, like I said, I have Invisalign in. But I was wondering if there were if you had ever seen any long-term, I don't know, like the bite being altered in people, or if that was ever a concern.
No, it's not really, because you realize after a while that a lot of people at the beginning, they really are stressed about, oh, I need to keep my mouth closed. and then so they're really biting hard. But you realize after a while that no, just relax your jaw. You can even part your lips by, like a fraction of an inch, and we'll still have the seal.
Yeah.
So the people who might feel that at the beginning, especially in the morning when you wake up, when the pressure happens on the front teeth, it's just because they're biting too hard, they're a bit too stressed. We tell them just relax. Try it even by opening up a little bit your jaw and your lips, and you'll see the seal will still be there.
Gotcha. Yeah. I think I probably was doing exactly what you said.
Yeah. Which is natural, which is normal. Yeah. But again, it looks easy to use, but there's those few little tricks that will help our patient be even more successful with it.
Yeah, right. Sounds good.
I think, just also ensuring that patients that are coming to try iNAP, they should be committed and motivated to use it. So we encourage people to stick with it for at least a month, if not longer, just to ensure that it is right for them. So that is a big part of the patients who are successful, the ones who are committed to using it for long term. So thank you.
Yeah, absolutely. Sounds good. Thank you, Olivier and Laurie. That was awesome.
I
appreciate it. Does everyone get that much time if they do their initial onboarding?
Yeah. Yes.
Okay. Yes, they do.
Keep using it and let us know if you have any question, concern. Again, as a you keep using it, you will experience more things, and then one night will be super successful, and some other night you will not have a very good seal, or maybe after 2 hours you'll say, oh, I don't need that. That's completely normal. It's just the adaptation. And yeah, we'll let you know as we introduce those new tool, new ideas, new method as well.
Sure, sounds good. Well, thank you guys for your time. I appreciate it.
Our
Very
pleasure.
well.
Thanks for having us.
Absolutely.